If you're at the end of your pregnancy, you may be wondering, what are the signs that labor is coming soon? In this video, we're going to break down some different signs and clues to let you know that maybe labor is coming soon, but also some of us don't experience anything and all of a sudden we're in labor. So we're going to talk about what to look for to know that you are actually in labor as well. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and currently pregnant with baby number 4. And this is something that I struggle with at the end of every pregnancy of when do I know labor is coming? How will I know that I'm in labor? You would think at this point I would be experienced and I would know, but I'll still Google, when does a 4th baby come? What are some statistics on this? So we're going to break down what are some signs of labor is coming, is impending, and also some signs that labor has begun.
I'm Roxanne. I'm a labor and delivery nurse and student midwife and mom of 3. And I, with my first, had no signs. I just woke up, contractions. But with my second and third, I did have some signs. Not everyone, again, feels them, but some common signs that people say that they have leading up to labor are diarrhea, so clearing the path for baby to come through. Nausea or vomiting, so you're just like eating less food and like have less desire to want to eat the food because, again, making sure that path is clear. Nesting, so like insane nesting is what I experienced literally the day before. I cleaned so much and organized so much of my house. Granted, I had not lived in it for a while because we were renovating, but I was like putting beds together. Like I felt the urge. I couldn't wait any longer for my husband to get home from work. So I put an entire bed together by myself at 40 weeks pregnant. Don't recommend, but back aches as well. So I also have back aches with both my second and third as like a pre-labor is coming. Like I had some it was like a tingling kind of backache in my lower back, itching. So people will feel just like itchy all over, which I've not had. People will report it very commonly. Not able to go to the bathroom, so constipation, where they normally were pretty regular. So these are like differences. So if you were constipated your whole pregnancy, like that's not a sign that labor is coming. That's just your normal day, normal Tuesday. But if you were regular and all of a sudden now you're constipated, that could be a sign. As well as what's called lightning. So this is where baby is dropping into the pelvis. So they've descended and engaged into the pelvis. Some people will say they felt that shortly before going into labor. This is not always a sign that labor is impending, that your baby has engaged and descended into your pelvis, but for some people, they felt it and then a few days later went into labor.
So it's important to note that all of those signs could just be like a normal Tuesday for you during pregnancy as well. It doesn't mean that labor is necessarily coming. Baby's engagement does not equal labor onset necessarily either. But for me, I always just woke up in labor. And there was no signs at all that anything was happening. I'm sobbing the night before because nothing is ever going to happen. And then I wake up the next morning and I'm like, I'm having contractions. Cool. This is neat. So you also may experience no signs.
Mood swings
labor
could
is
be a
coming.
sign, though.
Yeah. Which is just kind of in a pregnancy too. But
Yeah.
now, how do you know that you're in labor? Another sign that you may think that labor is coming, and it may or may not mean that labor is coming eventually, is if you lose your mucus plug. And so your mucus plug is like this ball of snot, essentially. It's like this mucousy glob that just kind of sometimes falls out as the cervix begins to dilate. And for some of us, you can begin to dilate before labor begins, but it doesn't necessarily mean that labor is impending by any means. Like you can be like 5 centimeters for weeks. You can be 0 centimeters for like a day and then all of a sudden be in labor. So dilation doesn't necessarily mean anything. But if you are starting to dilate a little bit, your mucus plug may come out. It's important to note that it regenerates. And so just because it comes out doesn't mean that labor is coming. But if you're having contractions and you see your mucus plug, it's probably because you're in labor as well. You also may not notice it at all. Like my last labor, I did not notice my mucus plug at all. My first 2 labors, I did notice it while I was in labor.
And with the mucus plug, sometimes it is like a clear grayish color, and sometimes it has like a little bit of blood tinge in it. So it can be like a spectrum of when you lose your mucus plug. I do find that when people have more of some blood tinged in there, it is more of a sign of like that early labor, and they normally see it in earlier labor than that like clearer, more grayer kind of mucus plug. If you lose your mucus plug, do not bring it with you to labor and delivery.
They don't need
You don't
it.
want to see it. It looks cool. You could take a picture, but you don't bring it to, I don't want to see it in person.
Now, what are some signs that you are in labor? So it's kind of ambiguous of like, is this a sign that labor is coming? And let us know in the comments below what you were feeling before you went into labor. So for Roxanne, she always kind of feels this tingly back pain that lets her know that labor is probably coming soon.
Even though I'm in denial, like the entire
For me,
time.
I feel nothing. I have no sign at all, other than I'm pregnant, that labor is coming. So let us know in the comments below if you experience any signs that was kind of like your clue, like I'm gonna have a baby like in the next day or so. But what are some signs that you're actually in labor? For a lot of us, especially if this is your first baby, you may think that it's going to be this big gush of fluid and your water breaking, and then labor is initiated from that. Most people do not have their water break to initiate their labor. Some folks do, but most do not. And so what we're really looking for is contractions and this sensation of this building type of contraction. And so the difference between like a Braxton Hicks contraction and a labor contraction is Braxton Hicks is usually just like a sudden tightening and then a sudden release. There's no build to it. There's no change in intensity. It can be uncomfortable or painful, especially if you're like dehydrated or super fatigued. Or for me, if I have to pee really bad, my Braxton Hicks are like very, very painful. But Braxton Hicks, again, just sudden start, sudden stop. There's no pattern to it. It's just like sudden tightening, everything's super hard, and then it's just gone. And then if you rest, you take a bath, you drink some water, you go pee, it goes away. And you can start experiencing Braxton Hicks like in your second trimester, sometimes earlier in the second trimester, depending on what number of pregnancy this is for you. Now, for a labor contraction, the way that I would describe it in my body, and you may describe it a little bit differently in yours, is I'm looking for this wave-like sensation. So it's going to start, it's going to build in intensity, peak in intensity for like 10 to 15 seconds when it's a minute long, and then it's going to decrease and lower in intensity. So there's a change of intensity throughout. I also feel it kind of like if somebody was like pulling on my skin or twisting the skin on my arm, that kind of like burning, pulling sensation is also what I feel in my lower abdomen. That lets me know that this is my uterus being pulled up and down and starting to push down on baby. And so it's this kind of like pulling, burning type sensation with it. Not like burning like someone lit me on fire, but again, if somebody was like twisting the skin on my arm, that type of like burning type sensation or tugging sensation. Yes, more like a rug burn type sensation. So I would describe a labor contraction similar to like the sensation of a Charlie horse, where you feel it coming, it peaks, and then it releases and lets go, but you can kind of still feel it. So it's the Charlie horse is not all tightening and intense. There's this kind of wave-like sensation to it. The other thing that we're looking for with a labor contraction is it's coming at a set frequency. So at first, it may be every 15 minutes you have a contraction, and then over time, it becomes every 10 minutes, and then it's like every 8 minutes, and then 5 minutes, and then eventually it gets all the way down to every 2 to 3 minutes. So over time, they're coming at a set frequency, but that frequency is increasing, so you're having more contractions over a shorter period of time, and they're increasing in intensity as well. And so those are like some signs that you're actually in labor. And I find that it's very distinct from Braxton Hicks. So let us know in the comments below how you knew it was a labor contraction, because again, we may describe it differently than each other.
Two other things that you might notice that you are truly in labor is one, your water does break while you're having these contractions. So that is a sign like, yeah, things are progressing. And this is probably the time to think about going to the hospital if it does break prior to you getting there. And then the second thing is you might notice, like if you didn't notice your mucus plug earlier in labor, you might start to notice it later in labor as like a bloody show. So this is like bloody mucus, and this is from your cervix dilating and changing. And this is a good sign of labor progress, but this is also helpful for people to know like, oh, yeah, I should probably go to the hospital sometime soon because this is bloody show. These are good signs that I am actually in labor. Because if you were like me and just like in denial, you just deny that you are truly in labor. You can't really deny when your water breaks or if you have some bloody show that you are actually in labor and you should go to the birthing location that you're intended to deliver at. With bloody show, there is a difference with bloody show type bleeding and true bleeding that would be a sign to go into the hospital to make sure that everything's okay. Bloody show is very mucusy and slimy. So it's really just like slime that's red in color because it's like stretchy and slimy.
But don't play with it.
Don't play with it, obviously. But blood, if you are having true bleeding where it's like running down your legs or like very watery type blood, if you put a pad on and it's like soaking the pad, those would be signs to definitely go in and be assessed because there could be some sort of bleed happening where maybe your placenta is starting to detach early or something's going on with baby and that's why you're having actual bleeding versus bloody show. There is a sort of difference between the two. Sometimes people will have a little bit of watery bleeding as that cervix is dilating, but for most people, if you have some sort of watery bleeding, going in to be assessed is recommended.
So you may or may not have signs that labor is coming soon. You may have some of the diarrhea, the nausea, maybe you have this sudden urge to nest.
Like me?
For me, I think I always had this feeling of like peace as well, like right before I went into labor where I think I just gave up mentally where I was like, fine, like whenever.
Peace or defeat.
Like whenever it comes. Yeah, so maybe it's more defeat. But sometimes that's the key. Like you just have to like let go and then labor can begin. Not always, but you know. So you may have a sign that labor is coming. You may not. Let us know in the comments below what you experienced to let you know that labor was coming. Or if you experienced nothing like me other than defeat and you just woke up in labor. Signs to know that you are in labor, though, is contractions are very distinct from Braxton Hicks. They're going to have a wave-like sensation, they're going to be at a set frequency, and they're going to get more intense over time.
And then if your water breaks, so it's a big gush of fluid, you put a pad on, you're saturating that pad in a short amount of time, or you're having that bloody show. Those are two great indicators that labor is progressing along with the contractions, and those are all good signs to go into your birth location or call your midwife.
And at any point you are confused, go ahead and call triage, call your labor and delivery, your midwife, and ask questions. Be like, is this normal? Am I in labor? What should I do? It's always helpful to call before you go in case it's like it was just your mucus plug and they're like, honey, just stay home. So that way you don't go all the way in. But if you are ever confused on whether or not this is labor, call your provider and ask them for their advice.
Don't feel like you're burdening or like wasting their time by calling and asking any questions. They're always happy to answer.
If you want more support throughout your pregnancy, check out our online prenatal fitness programs and our online childbirth education course. Our prenatal fitness programs are designed to help you physically prepare for birth and navigate your pregnancy feeling strong and pain-free. In addition to our prenatal fitness programs, we also have a standalone birth prep program if you already have a workout program that you really enjoy doing and you're just wanting birth prep specific movements to do that open all the different pelvic levels, release tension within the pelvic floor, and hopefully help you have an easier birth. In addition to our prenatal fitness programs, we also have our online childbirth education course, which breaks down the science of birth so you can understand what is going on, the labor timeline, the signs of labor, things to do when you're actually in labor. And the good news is you can bundle them both to save a little bit more. You can use code YouTube10 to get 10% off any of our online offerings to include our prenatal fitness programs, our childbirth education, and our postpartum support programs as well. You can check out all of our online programs on our website at MamasteFit.com, and we even have a quiz on our homepage if you're not sure what the best program for you is.